Hello, everyone, and welcome to the CDO Magazine interview series. My name is Ernie Ostick, SVP of Products with Manta Software, and we are partnering with CDO Magazine, MIT CDOIQ, and the International Society of Chief Data Officers in a series of interviews. Today, I have the pleasure of talking with Rahul Goyal, Senior Director of Enterprise Data and Analytics at Optum. Hi, Rahul.
Hi, Ernie.
So another area that you've explored is in the area of remote patient monitoring, which is just growing leaps and bounds. What safeguards need to be put in place regarding sensitive data, and how do you make customers, patients, whatever, more comfortable with the technology?
Yeah, I think it's with the pandemic, we certainly saw a rise of telehealth, and I think where the telehealth can be made more effective with the use of remote patient monitoring tools, especially people who have complex conditions, right? So think about for a moment, and I'm just trying to go maybe down the aspect of remote patient monitoring itself for a moment. Typically, when a patient shows up into a doctor's clinic, they have the data or the point of reference from that patient at that point of time, and maybe subsequent visits. But what they don't have is what's happening, outside the clinic or outside the facility, if they were in a facility. And so, what remote patient monitoring allows is to be able to gather, this wide data that typically previously wasn't available. Now, think what you can do if as a clinician, if you have all that data and how your patient's blood pressure has been over the last week, if you had information around how the medication has been interacting with their vitals, if you have information around what their lifestyle has been, and so I think the remote patient monitoring helps provide a lot of that viewpoint into an individual. And I just go beyond the data point because that's what the data is for, right? But in relation to sensitivity of data, I think the big part of it is a couple of folds, right? So one, it's an opt-in, right? I mean, you don't necessarily are getting a data without the consent of a patient or a member. They are opting into the program with a view of better care and better outcomes. So that's the opt-in piece. And the second piece is, how do you apply the data that you gather in terms of driving better outcomes for your patients. And this is where I start to see where AI can start to come, where now you have not only initial clinical data, but you also have other reference points of data, and of course a lot of data. And within that, you can start to see patterns or behaviors that might have better care outcomes or better care pathways for an individual, and being able to guide a practitioner or a clinician using the combination of RPM and AI kind of enables them to maybe have a better confidence in recommending certain pathways, but also a strong reference point as to what has worked, in the broader, their patient population or the member population. So that's how I think about from a RPM perspective on how that would continue to, influence a patient care more positively, but also on a provider side on how that's going to it's going to enable them to do a better work with their patients. I don't see of other sensitive reference points as far as, because it's an opt-in kind of a view. So obviously it is covered under the PII, PHI, the HIPAA compliance, which is very, very critical. And so part of that arrangement is like, what it can do for you and what do you expect out of that as a member or a patient.
It was very interesting as you were describing that, the satisfaction, not just the success rate, right? If someone, we start combining remote patient monitoring with AI, it's better care for that patient who's, of course, happier, more successful, recurring patient, that kind of thing. But it sounds like, the job satisfaction for the provider increases tremendously, right? Because they can be more effective in their job.
100%.
It's, multiple places where you have touch points of success on that.
Yeah, I mean, and again, like, we already have obviously some tool in the health industry where you show about like, drug interactions or combination of drugs or like, therapies and stuff like that. But think about like a provider now they have insight as to what your patient has been doing, and you almost have information in terms of alerts or real-time alerts, because you're picking up things on how the drug is effective or not effective. And is there things that you could do? I mean, and in a lot of conditions, there is you see there is over time, physicians will give you different drugs and different doses of, maybe the same drug,
right?
Just to see where you kind of land correctly in terms of, optimizing your health. And, maybe a few years ago, and even now, like, wherever you don't have some of these capabilities enabled, you're relying a lot on a gut feel, maybe of a patient, maybe certain vitals, like where they say, hey, like, oh, I feel this better, or I feel this is working, or maybe I need to go in sooner because I don't feel good with this drug, right?
Right.
But now, like, you could have that data in addition to, the device data, in addition to what a member or a patient will tell you. And so it's very, very complementary, and it helps to us to understand, I think, even beyond the care, as to, how as humans we actually work. I think which I find even more fascinating. Like, I don't think we had so many different reference points. We had some ideas of, around like, this is how the things work clinically. And when you come down, start practicing as a doctor, it's all about like, here is a typical process that you need to follow. Here are the things that you can, within your guidelines you can do. And now with the explosion of data, now you have all this information. It's just like, when you take the drug, how does your blood pressure changes, or how does your, your level of activity changes,
right?
Or what you eat kind of influences. So I think there will be a lot more as we continue to move into the future, understanding of our lifestyle, our nutrition, our social fabric, how all of that influences, us as humans and our health, which is going to be very, very interesting mix, and sort of like I think a forward step in our overall healthcare.
Yeah, we won't be able to hide things from our doctors either. I can't imagine wanting my doctor to really know that I didn't exercise this week, or look at my blood content and say, what were you eating? So we can't hide things, and our doctors will know all the truth, which in the end does provide for better health care. So that.
Yeah, I mean, the other way I put it is like, if you don't have this data, all patient does everything by the book.
Which we know doesn't happen.
Yeah.
We noticed that you're active on the startup scene with UV Health. What can you share on that?
Yeah, so so healthcare, I say, has been a passionate journey for me, and there's a reason I came into healthcare, and I wasn't necessarily like a person who understand a lot about healthcare before I came into healthcare, but like there was a big motivation because of some of my own family members and their ailing health. And so that was like, okay, I work in retail, I work in banking, or whatever that is. Before I was in healthcare, like what was my purpose? And like this was sort of like kind of gave me a purpose and a passion to come into healthcare. And so as I been involved in my work with United and Optum, which has been fulfilling in some ways, I also felt a need to explore some of the things around the understandings that I built. Like I was explaining around, like how as humans we function, and what's at the core of like various chronic health issues, and how you kind of go and chip away at those issues from a perspective of various perspective of wellness. And so a few years back, I started alongside my work, a startup, UB Health, which is focused on behavioral health. And so where we looked at behavioral health within UB was in a very different, again, arrangement to a typical traditional healthcare system, where we went down the path of, if somebody has a depression, what are the origins of that, and not just origins in some terms of the functional side of a member, but more so on how and what his body is experiencing, and why there is a issue that they're seeing in the brain. Like, for example, if somebody has been going through stress, and a lot of us go through stress, and I quote this example very often because most people can relate to it. It's like, with stress, your body has a natural mechanism of producing cortisol, and so cortisol is not necessarily bad, although it has gotten a bad rep over the years. But how does the body respond to cortisol, and what happens if you have a long-term stressful situation? Does your body stop responding to the effect of cortisol, which is its role is to reduce inflammation in the body? And so now all of a sudden you've developed lower response to cortisol, and therefore the glands that are producing cortisols, they are getting fatigue. Also, they're not able to keep up with the stress, as well as you're developing immunity to that. And so therefore now one of the pathways is depression. And so if you have that deeper understanding as a clinician, you might be able to say, hey, how do you not only tackle stress, but how do you boost the response of your adrenal function? And so if, like, from my own point of view, I feel like that's a proper response, right? Right. Treating somebody with. And so at UB, that's basically what we are trying to do, is basically enable clinicians and members understand those pathways as to what is causing different health issues, and how do you address those core issues with a combination of medicine and lifestyle.
So let's take a look at the crystal ball, kind of close out here, and talk a little bit what the future looks like, specifically for data challenges around analytics.
I think from my vantage point, from decades of learning, I guess, the challenges, there are going to be challenges for sure into the future, but you will have better tools to manage through those some of those things. You might have other challenges, like, unlike today, your data is continue to going to explode. So but then there are tools like, for example, around data lineage, or if you talk about AI ML, and the application of AI ML into different domains and businesses, I think those will continue to evolve and improve over a period of time. The key would be, end of the day, is having a strong understanding of the business and the domain, and being able to apply these different tools from that perspective. You cannot separate, data from the business, and I think that's where a lot of our focus has to be, is to have that strong understanding and application of the tool.
So thank you, Rahul. And thanks for joining me today, everyone. Please visit cdomagazine.tech for additional interviews, and have a good day. Thank you.